The unethical issue that I chose to address within the contents of this short video is animal testing. With that being said, each year more than 100 million animals, including mice, rats, frogs, dogs, and various other species, are killed in U.S. laboratories for biology lessons, medical training, curiosity-driven experimentation, chemical, drug, food, and cosmetics testing. Before their deaths, some are forced to inhale toxic fumes. Others are immobilized in restraint devices for hours. Some have holes drilled into their skulls, and others have their skin burned off or their spinal cords crushed. In addition to the torment of the actual experiments, many animals in laboratories are deprived of everything that is natural and important to them. They are confined to barren cages, socially isolated, and psychologically traumatized. The thinking, feeling animals who are used in experiments are treated like nothing more than disposable laboratory equipment. A Pew Research Center poll found that 52% of U.S. adults oppose the use of animals in scientific research. And other surveys suggest that the shrinking group that does accept animal experimentation does so only because it believes it to be necessary for medical progress. The majority of animal experiments do not contribute to improving human health, and the value of the role that animal experimentation plays in most medical advances is questionable. In an article published in the Journal of the American Medical Association, researchers found that medical treatments developed in animals rarely translated to humans and warned that patients and physicians should remain cautious about extrapolating the finding of prominent animal research to the care of human disease. Poor replication of even high-quality animal studies should be expected by those who conduct clinical research. Diseases that are artificially induced in animals in a laboratory, whether they be mice or monkeys, are never identical to those that occur naturally in human beings. And because animal species differ from one another biologically in many ways, it becomes even more unlikely that animal experiments will yield results that will be correctly interpreted and applied to human condition in a meaningful way. For example, according to the former National Cancer Institute director, Dr. Richard Klausner, we have cured mice of cancer for decades, and it simply didn't work in humans. The conclusion was echoed by former National Institutes of Health Director Elias Zerhouni, who acknowledged that experimenting on animals has been a bondugal. We have moved away from studying human disease in humans, he said. We all drank the Kool-Aid on that one, me included. The problem is that it hasn't worked, and it's time we stop dancing around the problem. We need to refocus and adapt new technologies for the use in humans to understand disease biology in humans. The data is sobering. At least 85 HIV/AIDS vaccines have been successful in non-human primate studies as of 2015. Everyone has failed to protect humans. In one case, an AIDS vaccine that was shown to be effective in monkeys failed in human trial because it did not prevent people from developing AIDS. And some people believe that it made them more susceptible to the disease. According to a report in the British newspaper The Dependent, one conclusion from the failed study was that testing HIV vaccines on monkeys before they were used on humans does not, in fact, work. These are not anomalies. The National Institutes of Health has stated therapeutic development is a costly, complex, and time-consuming process. The average length of time from target discovery to approval of a new drug is about 14 years. The failure rates during this process exceeds 95%. And the cost per successful drug can be $1 billion or more. Research published in the journals Annals of Internal Medicine revealed that universities commonly exaggerate findings from animal experiments conducted in their laboratories and often promote research that has uncertain relevance to human health and do not provide key facts or acknowledge important limitations. One study of media coverage of scientific meetings concluded that news stories often omit crucial information and that the public may be misled about the validity and relevance of the science presented. Because experimenters rarely publish results of failed animal studies, other scientists and the public do not have ready access to information on ineffectiveness of animal experimentation. That concludes my speech on unethical study. That concludes my speech on an unethical issue and the study of vaccines and things of such nature with animals. I'm more a opponent of the process than a proponent, but yet I'm not a vegan. I do not claim that I entirely disagree with animal research, but I mean, I'm not really in favor of it. I hope that you found this message informative. Thank you. Have a nice day.